A warm welcome to everyone out there to this recording of the Congress coverage from ESMO, the European Society of Medical Oncology Congress, which took place this year in Barcelona. My name is Alexandra von Korff, and on behalf of Patients Today and Mamma Mia, I warmly welcome you. Professor Thill and I were at the ESMO, and I am very pleased that he has agreed to present here the various studies that we have thoroughly considered and found interesting. Now, on the topic of triple-negative breast cancer, please, Marc.
Yes, dear Alex, how wonderful it was that we were so happy to be at the Congress. Now, we are, of course, very happy to have shopped there for you and to present it to you here now, namely data, Alex has already mentioned it, on early triple-negative breast cancer. The study that we brought, or rather very carefully selected, was presented in a presidential session. That already sounds important, and it is important. Only results that are, in modern terms, practice-changing are included there. This means that they actually then officially declare a new standard. These were the survival data collected from the KEYNOTE-522 study. For whom is this study relevant? We have already mentioned it. For triple-negative breast cancer with a high risk. High risk, one must say, can be defined in different ways. There really aren't any clear definitions for that. But in the study, patients participated who had a tumor larger than 2 centimeters in size, or who had positive lymph nodes, for instance. That already represents a higher risk for triple-negative breast cancer, with tumors that are larger than 2 centimeters in size or with positive lymph nodes in the armpit. In that case, the tumor did not necessarily have to be 2 centimeters in size, so these two criteria essentially declare this as a high or potentially higher risk of recurrence. You have probably already come across this study because we are already treating you based on the results of this study involving 1,100 patients. The idea behind this was combining a chemotherapy that was neoadjuvant, meaning before surgery, with pembrolizumab. And since we are on the topic of triple-negative carcinoma, in this chemotherapy regimen, with carboplatin and paclitaxel along with epirubicin cyclophosphamide as standard therapy with pembrolizumab combined with pembrolizumab, a checkpoint inhibitor, a substance that effectively counteracts the brake that cancer puts on our immune system, nullifying it and thus rendering it ineffective. This was attempted here in early breast cancer, and this led to a significant increase in pathological complete remission, meaning the tumor's response or the disappearance of the tumor after treatment, but also the disease-free survival, which colleagues refer to as event-free survival. This event-free survival was also significantly improved. You can say that it's all well and good. This has all worked, we also treat this way, and it makes absolutely sense. But in the end, the question always arises, does it also have an effect on overall survival? And if such a study has an impact on overall survival, then the result belongs in a presidential session. And now, of course, I have already given away the result.
If it weren't relevant, we wouldn't be presenting it, would we?
That's exactly the point, yeah. And that was also classically the endpoint of the study. So the people who actually wrote this protocol then dared to say, yes, we also choose overall survival as the endpoint. And it concerns again with neoadjuvants, which means that vital tumor cells are no longer detectable by the pathologist after surgery. And this is something that you may have already observed or noticed. Perhaps you have already been treated with it and can now take away, yes, I have received a therapy that really works and improves overall survival. And what we are already seeing here is an improvement in event-free survival by 35%. One must say that was indeed good and important, and that is where we first started treating with it. And the overall survival. I know these curves always look silly and they always go downwards, which is something you somehow don't want. And then there's always a little something in between. But honestly, with this improvement of 34% for the overall survival, we can indeed refer to these results as really significant and truly practice-changing. And one must say that this is something now after 7 years of follow-up, 5-year data, that there is really no way around this therapy anymore. Otherwise, it is like rejecting it somewhere. But of course, as you might expect, you also pay a cost for it, and that is not always pleasant. There are indeed side effects, and what we see here these are, I don't want to belittle this, but the standard side effects of chemotherapy. Nausea and hair loss naturally occur, anemia is very present, and also the white blood cells go down, you feel kind of tired and so on, as you can clearly see here. This is something where we say, yes, we actually recognize this from chemotherapy. But what we do not know from regular chemotherapy, but rather from an immunotherapy, because this is an immunotherapy, pembrolizumab, are then immune-mediated side effects. And here we see thyroid dysfunction and severe skin reaction and so on. So at this point, we must also say that anything can occur there, anything. A colon inflammation can occur, brain and appendages inflammation, kidney inflammation, adrenal gland inflammation. I had a patient with a muscle inflammation. And it is very important that for you, these side effects can occur even up to a year after the end of therapy. That anything that seems odd to you, please always inform your treating physician and say, I have had a checkpoint inhibitor, pembrolizumab, or I am still undergoing therapy. In conclusion, it is actually quite brief, because the combination of pembrolizumab and chemotherapy has now indeed led to an improvement in overall survival. This is something that does not happen very often, therefore it is considered a standard therapy. Analogous to the criteria for triple-negative breast cancer, early breast cancer with a tumor size over 2 cm, or positive axillary lymph nodes, and therefore it is part of the presidential session.
So great. I say 35%. You have to, wow, you can really say standing ovations. But of course, I certainly feel nauseous when I see how the side effects increase significantly as a result. And I believe it was also twice as many people who discontinued the therapy. If I saw that correctly in the numbers, which is probably also related to the side effects, that is, of course, another difficult decision to make. So, how long will this really last? Can I truly endure it? And what will it actually do to my life? But when you hear 35%, that's obviously such a compelling argument where you say, okay, I probably just have to try it somehow, and many are already doing it. That means that this will now be the new standard, is that correct?
Yes, so in the moment when you can actually improve event-free survival in early breast cancer, where the delta is not that large anyway, that is, the difference between therapy effect and already good prognosis. You have to say that if something is achieved there, then that is something we will use. Not just now for an improvement in pathological complete remission, not necessarily for that, because you never know if that translates into survival. But regarding the overall survival benefit, I believe everything is now clear. That's where the nail has been hit in a very German way. A point has been made now, and it will be hard to overlook that. But as mentioned, this is only for the patients who were in the study, and there will certainly be patients, and you said it, Alex, with side effects, where we say we won't do that for you. And then, of course, one complains and asks why. And that's here, and you mentioned it at Patients Today, etc. I would like to have that too. Then you have to say, yes, but you have already brought ABC with you. And then it is really difficult with the side effects.
Yes, it is probably always a very individual decision, as in every case, based on what one already brings with them, and whether they can still endure all these side effects. But as I said, the nice thing is we share the data here and thus have a very good basis for decision-making to then make the decision together on a case-by-case basis. That is indeed definitely very promising.
Yes, it definitely was promising.
Thank you. That was all from us on triple-negative breast cancer. And now we will briefly address another topic.
That's exactly what we will do.